Hello everyone, this is Bhad Arif. I'm a psychologist by profession and I'm a researcher as well. So I'm here to speak or to discuss or to present on the topic of basically it is an overview of grant writing. So I am presenting here to lead a discussion or I would say like to start a group or to gather researchers from the globe, specifically from Global South, having expertise, education, qualification from Global South countries, Nigeria, Pakistan, Egypt, Lebanon, Syria, Ghana, Zambia, Mozambique, Zimbabwe, Malawi, Bangladesh, India. So we received requests from people around from these countries if we can like start a group of grant writing. So interested individuals, academicians, PhD scholars, lecturers, professors. So we all can come together on a platform and start writing grants, start hunting for grants, and uh, like to build capacity in these countries and to contribute to the health system so that we have an impact on a broader scale. Like after getting grant, then to implement it and then informing policy so for a longer or better change in these countries. So I am here to present on the topic of overview of grant writing. So I will take everyone from the very start till the end. So like I will try my level best to explain people in simple plain English language so that everyone can understand. So to start with, my first slide reads get, read, follow. Get the guidelines, read the guidelines, and follow the guidelines. So the idea of putting this slide over here is whenever we have a grant, we have a call, we should have RFP, request for proposal of that grant, and we should read it thoroughly. Once we have that PDF version or the link of that website, we should read it thoroughly. We should read it once, twice. We should read that individually or in a group so that everyone so if an individual is missing something so that someone else can point out that the criteria, the eligibility or institutions eligibility or the focus of that grant, budget guidelines, what they're asking for. So we should not miss that. And whatever our institution is, that should meet those guidelines. So this is get, read, and follow. We should have the proposal, we should read the guidelines, and we should follow what the funders are asking for. So next we have before going further, so we as an individual or as a group, whenever we are submitting a grant, we should meet the guidelines. Meet we should initially we should understand what they are looking for. So once we have understood what they're looking for, then we have to build a grant according to that particular call, what they are looking for. So we have to put that thing. We should sell what they're asking for. So rule number two is consider the long-term goals of your institution. So once we have a grant, obviously it can be a feasibility study or pilot study. Then moving on, once we complete that grant, we should have capacity to scale up or to scale up from that results of that research or grant. So that was about to rule number three, start with the end in mind. So whenever we are going for grant, we should ideally visualize the end of that project. So from understanding the RFP, collecting people, writing that grant, submitting, getting that, delivering to that project, and then see what's next, what we can do. So rule number four is identify yourself and your strengths. So we have a grant, we know their criteria. So we should be aware of our strengths, we should be aware the strength of our team. So it can be like that the funder is looking for a call of public health, but our strengths that our team does not have that requirements. So we may not be able to write individual or write for that call. Ideally, public health experts having education, qualification, experience, prior experience of research, prior experience of grants, they should be in the team. Same cases for the institution. So, funder is looking for mental health experts or mental health institution. Then, ideally, a mental health institution with having qualified and experienced individuals and an experience of research projects and delivery of research projects of mental health, they are ideal in the case to apply for that grant. Rule number five is create a comprehensive plan, not just a proposal of what you wish to achieve. So it is not about the proposal, or it is not about the grant that we're looking for, rather a comprehensive plan, a practical thing, that how we are going to deliver that project, deliver that grant once we have it. So it should be practical. It should be practical, whatever we are writing in that call. So moving on to next slide. So funding bodies look for good researchers. Think of them as potential investors in you and your ideas. You must sell your idea, be enthusiastic about the work. Why should they give a grant? See it from the funder's point of view. So these are very important things that a researcher should keep in mind while they're submitting a grant or developing an idea. So it should match what they're asking for. Rather, see, we are not begging for money. It's like they are here to support our project. They are looking for potential researchers, potential grant writers, or institution, those who can implement their idea. So the proposal, it should be in a way that we are selling ourselves, our work, to get on the point what they are looking for. So good researchers, they know how they should develop their grant, each section, how they what kind of individuals they want in their team while they are putting a research grant. So this is a very busy and lengthy slide. I will go one by one. So all the parts of a grant are mentioned here in this slide. So to start with the title, title should be very simple, self-explanatory. It should be in simple, easy English language, and it should convey what it is in the grant, what we are writing, what we are submitting. So once our titles is on the desk or on the email or pop up in the email of a reviewer, the reviewer should be able to understand what he or she is going to read in the whole PDF, in the whole grant application. So that the title is that important. So whenever you are developing a title, just don't think that it is something that we should not give time. Rather, give yourself time and put energies in developing a good comprehensive title. So next we have summaries, lay and technical. So we have a number of funding bodies across the globe. So it doesn't have to be like that the funding body has that experts of that particular field. Like let's take an example of mental health. Let's suppose we are putting a grant application in NIHR. So maybe NIHR, maybe there will be no mental health experts in their panel. So then or may not be the case. Rather, then they ask for like lay summaries or technical summaries in the grant application. What is a lay summary? So lay summary is a summary of the grant application in simple, plain English language with non-technical, non-scientific words. So if a funding body is asking for that, maybe they may send a grant to uh, those potential reviewers having not background of that particular subject. So so maybe the grant application is on mental health. Then maybe those reviewers, they having a background of oncology or orthopedics, but obviously they must be good researchers, good reviewers of years of experience. So lay summaries, yes, that is the case where they are used. And technical summaries are those having scientific language. You may say a scientific abstract of the research of that research grant. So the funding body may have scientific experts, but may not be of similar field. Then they ask for these lay and technical summaries. Research questions: how we are going to frame what our hypothesis, what we are looking for. Everyone is. So this is not something a very like grant specific, rather a research oriented thing, and everyone must be aware of this. So aims are objectives, what we are looking for, what we want to achieve from that grant application. We have to write it precisely in short bullets or paragraph, whatever is required, whatever they are asking in the RFP. So introduction, background, concept overview. So we have to be very careful what they are looking for, what kind of word limits they have put in the RFP. At times we see that at times, most of the times, the funding bodies have mentioned a word limit that we should write 200 intro or background of 200 words or 400 words, 500 words. So we have to do in that limit, ideally having recent references, recent literature, strong literature, which aligns with our research, what we are putting in it. So problem statement is of concern or focus, or the focus of the grant, what they are looking for, and around what our research revolves, what kind of method we are using, qualitative, quantitative, mixed method. So depending upon the requirements of the grant, what they are looking for, so we may like design according to that. Sample size should be calculated based on like what and it also depends on the budget, how much, how what is the strength of the budget, like are they offering it well, or there are constraints. So but then we do count that what is prevalence of that health problem in that locality or that geographical region. So we can calculate that based on the prevalence and other factors. So impact, so our research, uh, will that be impactful or not? So we have to write in that section that what impact will our research have on the broader society. So we may write it based on geographical area like city, state, province, country, or LMICs, high income countries, South Asia, Asia, Africa, Middle East, North Africa. So it all depends. The funding body, or the research grant. Selection of key personnel. This is something very important. So as I mentioned earlier, that the team should be qualified, having experience, tons of experience, having experience of research, having experience of grants, and they should be relevant with the call, with that health problem. So having key experts, having key experience people, that 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 counts a lot. That makes the difference at times. That so one may develop a good draft, but having less experience or not qualified, they may suffer in that grant. So timeline can chart. So when at a times it is mentioned that the RFP that the call is of 2 years, 3 years. So researchers have to see that how they can plan it, how how they're going to build a timeline of those 24 months, 36 months, or 48 months. The preparatory stage for ethics application, for protocol, or training of key personnel, training of researchers, other documents, hiring and training, and then starting the trial, recruitment, follow-ups, data management, data entry, analysis, dissemination, and all the reports. So they have to be very careful, and the Gantt chart or timeline should be very realistic as as required in the RFP or grant. So patient and public involvement, this is you may see a bonus, a key aspect of a grant. Let's suppose, as I mentioned earlier, that let's suppose if a grant is on mental health, then a service user, a carer, uh, inclusion of a service user or carer in that grant application as a co-applicant or investigator, that that helps a lot. So having that individual in that grant strengthens the application. So that individual can like help build documents, their expertise, or rather I would say their advice, being a service user or carer, they can help modify the topic guides, documents, intervention, and things like that. Dissemination plan, so normally whatever we see like conferences, media, electronic media, print media, social media, platforms like LinkedIn. So all these platforms are used for dissemination of research. Budgeting, costing. So most of the time their limits are mentioned in the grant, that what is the upper limit or lower limit, how much we are supposed to utilize. Overhead costs are can be used the budget or resources for salaries, or what is the limitation of using salaries, or we are just supposed to use that for main data collection or research, that thing. So we have to very carefully read that section of budget from that grants call, so that will help us develop the budget. So it's like the individual, or the team or the finance team should sit and understand that, because this is something very significant. We cannot afford a mistake. Even a mistake can cost the team a lot. So next we have letters of support, cover page letter. So letters of support. So again, I would say if you're putting a grant of mental health in a low income country, so we may ask governments, provincial governments, local governments to give us a letter of support, like stating that about the institution or the individual that they have expertise in this field, and the government can support them, and the government wish to support that institution in this grant application. If they're successful, we may be able to support that institution or group of researchers or an individual. So this is a technical, you may say, a one pager from the government bodies or other institutions. Case for support is the main body of the grant. So it all depends what the funders are, what funders have kept page limit for this. It can be a two pager, one pager. And it also depends either we are on stage one or stage two. So stage one normally have less pages, like a one pager document outline stage, two pager document. So once successful on stage one, then the funders look for full proposal that may be around 10, 20 pages. So case for support, this is the main crux, main body, main document which the team has to prepare, and everything should be included in the starting from introduction, background, method, dissemination section, and all the sections in this thing, and carefully written, well, scientific thing should be in that. This ethics, just like research, ethics should be mentioned, maintained, and ethics should be sought before the start of the project. So that was a quick overview of all the parts of the grant application that an application should have. So now I will move on to next slide. So institutions qualifications. I mentioned this earlier in my previous slide, that the institution should be qualified. The institution should have legal safety, legal cover, registered in that local country, local geographic region, and they should have required personnel with required education and qualification. So having prior experience of research or grants, or so then the funders may be able to see this. They will say yes, they have the capacity, they can deliver it what they are committing. So having required resources, whatever the funding body is looking for, so that has to be in that institution. So each funding agency has specific requirements and guidelines to develop budget. Consider reading guidelines to develop budget accordingly. I mentioned this 2 slides back, that each funding body has separate guidelines, separate rules for budgets, heads, budget limits. Upper limit may be different, lower limit may be different, depending upon the call or funding bodies. So it all depends on the funding agency, how they have built that call. So the finance team has to read the guidelines carefully, and then they should develop and get it reviewed from experts or senior individuals. Appendices, I mentioned in my earlier slide as well that having CVs and letter of support. So each funding body has a different format for the resumes of the co-applicants, PIs, co-PIs, co-investigators, researchers. So at times they just ask for a one pager and with certain guidelines. At times they provide us a template of bio sketches. So we are supposed to put information what they're looking for from the resumes. So it depends and it varies from funding agency to agency. Letters of support, I explained it earlier as well that the governments, local governments, provincial, federal governments, or other institutions, they will write that they support the a proposed project from their point of view, and if they are awarded, then they will be able to support us. So submit the grant. So one aspect is this: see, once we develop the grant, so it varies from funding. So, submitting the grant. So, at times, the funding body, funding agencies, they ask us to send that the proposal or the or current documents along with budget to their email. So, this is the most easy part of submitting the grant. Though we have agencies, they have portals. So, and even few agencies, they ask the institutions to get themselves registered on the portal like a month ago or 2 months ago so they can process that institution. But there are certain institutions as well, those they ask for the institution to like just go and register themselves with the basic details of the individual, the education qualification, and the details of the institutions, and then document, then they can upload the document on the portal, the case for support, resumes, letter of support, budget, and then they can just submit. So the individual who is submitting, they should be skilled. They should be technical enough in the computer. They should be computer literate, rather, I would say. So those who do not have expertise in this thing, they should seek help from those who are expert or having or are familiar with portals or having a good computer literacy. So that was about submitting the grant. I should move on. Yes, page limit. So we cannot go beyond limits. So each call has certain guidelines, and they always mention page limits, even word limits for certain sections, ethics, dissemination, or introduction, or background, or abstract. So we have to follow those guidelines rather than going beyond that. So otherwise, it will have a very negative impact uh, on the reviewers. So the final documents, if they're asking for a certain type of font size, font type, Word document, PDFs, Excel files, whatever documents they're asking for, they should be neat. Additional extra information should have been removed from those documents. Comments of colleagues on certain things, unnecessary highlights, they all should be removed, and the final documents should be neat and clean. So yeah, this is, yeah, if documents are supposed to have signs, the signs should be present. One should not forget this thing, or any other requirement, whatever the funding agency has asked for, it should be in those documents. So a grant is a collective team effort. People from certain elements, certain domains, several domains, they come and sit together and put joint efforts. So people from budgets, they have certain expertise of mathematics. Statisticians are involved in sample size calculations. Then the grants office of departments or colleges or universities, they support the team who is putting efforts together. And then we have certain experts of that particular domain, either peds or orthopedic oncology or any other domain of specialty, what the funding body is looking for, and whatever the grant team has. So all in all, overall, it is So people from different domains come join together to put efforts. So that's how a team is built for a grant. So the first the first thing, deadline not met. So each funding body, they state it very clear, their deadline in terms of year, month, date, and time zone. So time zone is very significant. So one has to understand what time zone they are in, and how many hours, the gap of how many hours between both the one who is submitting and the one of funding agency. So at times I've seen people, those who weren't able to understand that, and they missed the deadline. So guidelines not followed. This is something very important. The team should carefully read the guidelines, whatever they're looking for in terms of team, concept, project. That should be strictly followed. Otherwise, the funding body will reject that. So the literature should be latest references, and all the team should be qualified, having experience of research, either PI, co-PIs, investigators, co-applicants, and institution as well. So the case for support, the grant should be carefully written of the quality of writing should be excellent, above excellent, structured in a way that the reviewers should be able to understand what we are asking for. Rather, they are keep on looking what it is actually, what we are trying to say. So yeah, that is all. We should meet the priorities, what they are looking for. Method should be strong enough as per given guidelines. Budget should be very realistic. So budget should align well with our proposed project. It should not be like that we are asking for a huge amount of sum, though our project does not require. So the alignment between the mathematics or the grants team and those who are writing, academic experts, they should sit together and evaluate both things to avoid any discrepancy. So that was all about proposals, why proposals fail. Let's suppose our grant application is rejected. We should not be sad or depressed, though we should ask for comments of reviewers, and based on those comments we should improve our sections, we should improve our grant, and be ready for next calls. So hopefully out of three, one should be successful. So it was a quick overview of the grant writing. I hope people will be able to understand from my talk, from this presentation. And in case of any query, they may drop an email. The email will be given in the description of this post. So the idea of this talk is to build capacity, is to explain grant writing in simple, plain English language. So people from underprivileged areas, global South, North Africa, South Africa, Middle East, South Asia. So people from these countries, they should be able to understand it, and they should start forming groups, come together, and start putting applications. So that was all about from my side. I hope that will make a difference.